Ladies and gentlemen, some more great news. Here's why Trump and Elon Musk see potential in chloroquine to treat cases. Now, there are no new cases. This is CNBC. We'll get to chloroquine and then hydroxychloroquine. The FDA is expediting this based on research as a treatment to what's going on. So, what is chloroquine and why is it considered a promising potential treatment? Elon Musk and President Trump have both touted the drug on social media. The early data is promising, scientists and biotech experts say. Now, we already had no new cases, according to the government of China. Now, I got rebuttals from my last segment. You believe them? Well, why didn't they just cover up the whole thing to begin with? If they're not to be believed at all, why didn't they just cover it up? Why didn't they just blame it on other countries? Why not? Why not? How does it behoove them to say no new cases if there are new cases? It doesn't. It doesn't. Their medical community is better off telling the truth. Yeah, I understand governments, and especially that type of government, whether it's a communist government, but what about our capitalist government? You think our government also tells the truth all the time? You think that the Democratic Party tells the truth all the time? So you have to, if there's no new cases, it behooves them, first of all, from a medical perspective. And first and foremost, they have to take care of this from a medical perspective. If there's no new cases reported, in China, that is huge news because it's the epicenter. We can learn from what they've been doing, I should say, this is not going to become as bad as people or people on the left or media has said it is. But here, what is chloroquine and why is it considered a promising treatment? When Dr. Mike Paletti, a physician and biotech investor, read the news about the spread, he decided to keep on hand a supply of anti-malarial drug called chloroquine. Paletti, who tweeted about the decision to his followers on early February, was early to his thinking. A month later, Tesla CEO Elon Musk sparked massive interest in the drug after tweeting that chloroquine was, quote, maybe worth considering as a potential treatment for everything going on. So on Thursday, the White House took notice. President Donald Trump said he had directed the Food and Drug Administration to investigate whether chloroquine, which is available by prescription only, should be given to patients. Bayer, the international, then noted in a press release that it would donate 3 million tablets of chloroquine phosphate to U.S. patients. Trump also pointed to another existing drug, remdesivir, an antiviral developed by drug maker Gilead, which is already being used in China. To treat what's going on. So there's already a drug that's a treatment that's being used, and now there's no further cases. Neither drug is currently approved by the FDA to treat the corona. So it is important not to provide false hope. FDA Commissioner Stephen Hahn said in a White House daily press briefing. But Trump has asked to be aggressive and break through exciting life-saving treatment, and we're going to do that, the FDA, he said. Early promising data. So what is chloroquine, and why is it considered so promising by the scientific community? The drug has been around since the 1940s and is known for being generally safe and well tolerated in mild to moderate doses, although it can be toxic in high doses. It has been used to treat malaria in addition to some autoimmune disorders. It is available as a generic, which means it could be a scalable and potentially affordable treatment. Nothing is definitive yet, but chloroquine is a drug that drug used for more than 70 years with minimal side effects at a modest dosage, said Polini. Malaria is caused by a parasite, not a virus, but some studies have found that chloroquine has been effective at treating a virus that causes severe acute respiratory syndrome. Okay, or SARS, a close relative of... Okay, it is also being studied at research labs throughout the world as a way to alleviate symptoms for patients diagnosed with. Okay, it has been found in mice to be effective to treat a variety of viruses, said Dr. Christian Olson, an associate professor at the Harvard Medical School and internal medicine physician at Massachusetts General Hospital. It also appears it's active in vitro via test tube experiments against what's going on. Okay, some of the early data is promising. A group of researchers in France are testing a less toxic derivative of chloroquine called hydroxychloroquine on a few dozen patients with early reports of the trial indicate that the drug might help shorten the amount of time that people with the disease are infectious. Because of these early signs, some biotech experts say it's worth putting more research dollars into studying the drug. Okay. So, this is a strong possibility. Trump says FDA approved anti-malaria drug chloroquine to test as treatment. President Trump said in a Thursday press briefing, this is Forbes, what I read you just now was CNBC. President Trump said in a Thursday briefing that chloroquine and hydroxychloroquine, drugs used to treat malaria and severe arthritis, were approved by the Food and Drug Administration. As the number of cases continue... Okay, so there are no new cases in China. So you can believe it or not believe it. If you don't believe it, then why do you believe that it even started there? Why did they even report that there are new cases there? Can somebody explain that to me? So you believe China when they say that it started there, but you don't believe them when they say there's no new cases? It's also been like the first case was like in November or early December. Okay, it's been a while. It is not as this is not as horrendous as the media. Here we go. The media is making it out to be more horrendous than it is. So there you go. So that's one reason to believe that when the government of China says there's no new cases, and I'm not even sure that whether it was the government or the bottom line is that is huge. The fact that at the epicenter there's no new cases, and the fact that we're already looking at certain treatments, this is not Armageddon. This is not the apocalypse. To shut down society, to shut down life, to shut down the country? For what? For what? You had, 30,000 people lose their lives yearly on the roads, in traffic accidents, in vehicular violence. Notice how Democrats don't use any euphemisms for that. Oh, that just happened, They don't say vehicular violence. Anyway. The drugs will be used in a clinical trial, according to FDA Commissioner Dr. Stephen Hahn, who spoke during the press briefing. Trump also said that the antiviral medication will be fast-tracked for FDA approval. Fast-tracked for FDA approval. Trump also said that the antiviral medications will be fast-tracked for FDA approval. So there you go. You have French researchers, you have Elon Musk, you have the FDA, you have biotech investors. There's something there. Is it a panacea or some kind of immediate miracle cure? No, I don't. Who knows? Could be. Maybe not. Maybe not. But if it reduces symptoms, that's the main thing. You're talking about the big problem here is that they say, well, this is not the regular type of flu. It's worse. It's worse. Well, if it reduces symptoms, that's all that is needed, or that's very important, I should say. So Trump said that the other antiviral medications will be fast-tracked for FDA approval. We will collect data to make absolutely right decisions based upon the data about safety and efficacy and treatment. Trump also claimed the White House has slashed red tape to speed up the approval for vaccines and other treatments. Trump added the FDA approved compassionate use for a number of patients, which allows very ill patients to use drugs not yet approved by the agency for widespread use. Good. So this is important. President Trump is doing exactly what he needs to do. There are people on Twitter like, oh my God, Trump costs lives. Well, you had 3 million Democrats. You had 3 million Democrats in Florida, Illinois, and Arizona. So spare us the doom and gloom and Mad Max and Waterworld and Escape from LA, Escape from New York scenarios here. The dystopian novel is slowly coming to an end, Democrats. So sorry. I know that you were just enjoying the book. Oh my goodness, the book that you were writing on how this is going to defeat Trump. Give me your thoughts below. You have a situation, ladies and gentlemen, where there are no new cases in China. The cases are not spreading, or they're spreading, but they're not. This is not a cataclysmic event for the United States of America, even though, yes, there are people, but it's like less than 100 who have lost their lives, which this is horrible, yes, of course. But like I said, there's an average of around 30,000 who lose their lives in traffic accidents. 12,000 plus lost their lives during the one infectious disease, H1N1, in President Obama's administration. 12,000. 12,000. No businesses were shut down. The country was not shut down. 12,000. Okay. So, and we've located at least a potential remedy for this, where you have French researchers and Elon Musk and the FDA saying, okay, we're going to President Trump saying we're going to fast track this. Give me your thoughts below. This is actually really great news. And it's like, yeah, I get it. There's always a way to look at things from a negative perspective. Well, that's not true, and this is just a ploy, and this is just a ploy, and it's going to get worse, and why is it going to get worse? Because CNN says, because MSNBC. Look at what has taken place under President Obama's administration. You don't have to look far. You don't have to go back in history, too long. Look, 12,000 human beings lost their lives. We're not anywhere near that, and the country is shut down. So how does that even work? How do Democrats, how does media justify all of this? Give me your thoughts below. This is actually really great news. Subscribe to H.A. Goodman's other channel right this